Welcome to our training on measuring success in case management services. This training consists of watching this video and reviewing the documents in the lesson media section of this lesson. When you are comfortable with the material included in this lesson, you are required to take the attached quiz with a passing score of at least 70% in order to successfully complete this lesson. We hope that you find this information useful to you in your work. In trying to measure success in case management services, we actually want to look at the outcomes of our services. Throughout the service period, we should be documenting in our progress notes measurable indicators of the outcomes of what we do. In human services, the outcomes that the professional literature suggests as the best outcome measures are increased quality of life, higher levels of functioning, fewer days spent hospitalized, and less dependency on community programs. In the following slides, we will take a close look at each of these measurements. The professional literature suggests that the concept of quality of life is defined by the domains that are listed here. There are differences in the importance of each domain dependent upon the person's diagnosis and severity of problems. Specifically, those individuals with more severe problems are more focused on things that take quality away, whereas those who have less severe problems are more focused on things that add quality. The first of the domains identified is well-being or ill-being. In general, well-being refers to an individual's comfort, health, and happiness. The general definition also includes good mental health, high life satisfaction, a sense of meaning or purpose, and the ability to manage stress. When supporting people with mental health issues, when we focus on well-being, we avoid relying on more traditional measures of mental health, such as symptoms of illness. One of the seminal articles on defining well-being was written by Rachel Dodge in the article The Challenge of Defining Well-Being, which is included in this lesson in the lesson media section. As this picture describes, she states that well-being is a balance between resources and skills that an individual has as they face a variety of challenges. The resources that Ms. Dodge describes are self-awareness, food, water, and shelter, health and vitality, a sense of purpose, motivation and enthusiasm, and social support and community. The skills that she describes are life experiences, the ability to communicate with oneself and others, emotional intelligence and stability, adaptability to change, creativity, motivation, and any vocational or academic skills. Finally, the challenges that she describes are situations that the individual faces on a daily basis that demand that the individual respond. These challenges include everything that is happening inside of us and outside of us: our relationship with ourselves, our relationship with our partner, friends, family, colleagues, and the community, any event that is planned or unplanned, and finally any event that is favorable or unfavorable. All of these factors interact to produce a person's overall sense of well-being. The next domain of quality of life is relationships and a sense of belonging. The positive elements of this domain include fitting in with society, the quality of relationships, specifically the importance of caring, loving, and supportive relationships, companionship and camaraderie, and acceptance and understanding from the larger society. The elements of this domain that negatively affect quality of life include critical and judgmental relationships, stigmatization, and rejection and lack of understanding by those close to the individual and the wider society, all of which lead to feelings of loneliness, isolation, and detachment. Individuals with mental illness believe that it is not only about how they fit in with society, but also about how society fits with them. They frequently describe a sense of feeling different and disconnected. Stigmatization is most experienced by individuals with a diagnosis of schizophrenia and those with varying gender identity. The quality of experiences in relationships with others has the capacity to both add to and take away quality of life. There are benefits to having someone to talk to, feeling accepted and understood, experiencing love, care, affection, and companionship, and having someone to trust and rely upon. Individuals with more severe mental health concerns may have more difficulties in forming and maintaining the type of relationships that they desire. The next domain of quality of life is level of activity. Level of activity has a positive effect on well-being. Both leisure and work activities lead to a sense of belonging through social interaction and generate feelings of self-worth, pride, and a sense of achievement. The more meaningful, purposeful, and constructive the activity, the better it is for quality of life. Individuals with severe depression may find little meaning or enjoyment in any pursuit. If an activity is felt to be beyond the individual's capabilities, such as work, it is likely to have a detrimental effect on quality of life. The next domain is the person's self-perception. This includes the concept of self-efficacy, self-identity, self-stigmatization, and self-esteem. Regardless of diagnosis or severity, a lack of self-confidence will prevent the person from doing things that they want to do and being the person that they want to be. A fragmented and incoherent sense of self and identity may be reported by individuals who have more severe psychotic disorders. Individuals with depression or anxiety may describe a desire to return to the person they used to be. The next domain is the person's sense of autonomy, control, and choice. There is a complex balancing act between support and independence, and so a person's desire for dependence or independence will often vary depending upon their current circumstances. Feeling independent is important to dignity, pride, and privacy, whereas feeling dependent may lead to feelings of guilt and of being a burden. Gaining a sense of control involves the development of strategies to cope with life circumstances. The availability of choices and opportunities are also related to a sense of autonomy. The next domain of quality of life is the person's sense of hope or hopelessness. A positive view of the future is essential to quality of life. Having goals and aspirations are necessary to undertake change and to have hope for a better future. Unsuccessful attempts at change or insufficient coping skills may lead to feelings of hopelessness. The final domain is physical health. Physical health problems impact quality of life and may affect mental health as well. Conversely, mental health problems have a direct negative impact on physical health. Difficulty with sleep or poor eating habits take a toll on physical health. For individuals dealing with mental health difficulties, there may be physical sides to any medications that the person may take. There are literally more than 100 instruments that have been developed to measure quality of life. Some of them have been rigorously standardized, while others are more informal measures. Not all of them measure all of the domains that we have previously discussed, but most of them measure a variety of these domains. I want to highlight two specific standardized instruments for measuring quality of life. First, the most widely used and reviewed instrument is the World Health Organization Quality of Life Scale. The instrument and the manual for the test are attached to this lesson in the lesson media section of this lesson. Additionally, we have provided you with a copy of the McGill Quality of Life Questionnaire, as it is a simpler version of a questionnaire than the World Health Organization scale is. But beyond using some kind of instrument to measure quality of life, a professional assessment of quality of life should be completed as a part of the initial assessment, and that assessment should be completed several times through the course of treatment and again at discharge from services. While these types of assessment will not produce research quality data, it will begin to provide us with a way to measure success. The second way of measuring success in case management services is to look at level of functioning. In the good old days, we assessed level of functioning using the Global Assessment of Functioning Scale, or the GAF, as a part of the diagnostic process. When the DSM-5 was published in 2013, the GAF score was eliminated as a part of the diagnostic process. The World Health Organization has published the Disability Assessment Schedule 2.0, or called the WHODAS 2.0, which is a much more formal method for assessing a person's level of functioning. In the World Health Organization's classification framework, disorders result in specific impairments in functioning. The term disability encompasses impairments, activity limitations, participation restrictions, and denotes the negative aspects of the interaction between an individual with a health condition and that individual's environmental and personal context. The overlap between an illness and related distress, functional impairment, and disability can be significant, partial, or non-existent. Therefore, none of these related aspects of psychiatric disorders are included in the diagnostic criteria of a disorder. In addition, two individuals can have the same disorder and the same functional impairments, but different degrees of disability depending on the personal and environmental factors. Therefore, although related to illness, neither impairment nor disability is considered an inherent feature of any medical or psychiatric diagnosis and should be assessed separately. A copy of this instrument is provided in the lesson media section of this lesson, as well as a guide for the instrument. The instrument identifies 6 domains that define level of functioning and impairment. These domains include understanding and communicating, getting around or mobility, self-care, getting along with people, or called social and interpersonal functioning, life activities at both home, in school, and in work, and participation in society, such as family, social, or community activities. A thorough assessment of level of functioning includes all of these domains, but unfortunately, level of functioning in mental health and substance use services has far too long only looked at self-care and life activities when assessing level of functioning. The next outcome measure that we can use to measure our success is the days of hospitalization for the person served. We can select any period of time to measure days of hospitalization, but the most frequently chosen period of time is in the last 30 days. If we were to choose to use this measure at the 30 days period, then we would want to document the days of hospitalization in the last 30 days at admission to the program, every 30 days while the person is participating in our program, and again at discharge. The most recent study that I could find was completed in 2015 and reported an increase in hospitalizations for mental health and substance use concerns of 12.2% from 2005 to 2014. This was the only category of hospitalization that increased in that time period. For all conditions, the number of hospitalizations dropped by 6.6% during that time period. The reason that days of hospitalizations is an important measure is that the avoidance of hospitalization is a measure of stability for individuals with mental health or substance use concerns. Hospitalization is usually a response to some type of crisis for the person. And when the person has the coping skills to avoid developing life crises, then the person can avoid hospitalization. And the development of appropriate coping skills is one of the main goals of the case management intervention. The final outcome measure that we can use to measure success in case management services is the number of days in a given period that the person is involved in community programs. While this goal may sound like it is putting down involvement in community programs, it is just the opposite. Community programs play an important and critical role in the lives of individuals with mental health and substance use concerns. It is through involvement in community programs that the individual begins to build involvement in the community and in society. However, long-term involvement in these programs is indicative of a stagnation in the person's progress toward independence, autonomy, and a meaningful life in the community. Meaningful involvement in the community is the goal, not the involvement in community programs. These programs are a stepping stone to the ultimate goal. Again, any time period can be evaluated, but a 30-day period may be the best measure. The way to define a community program would be any activity where individuals with mental health or substance use issues are segregated from the larger community. There are some activities that may continue for a long period of time, such as seeing a doctor for medication or attending support groups. The goal in this outcome measure, however, is to replace segregated activities with integrated activities to arrive at the place in the person's life where that person has a meaningful life in the community. While we can use formal, standardized instruments to measure quality of life and level of functioning, the use of these instruments is not required for us to begin the process of measuring these outcomes. The last two of the outcomes, days of hospitalization and days of involvement in community activities, are observational. All that we have to do is make it our business to track this information. Instead of a formal process, we can use an informal process, which is presented here in the next 3 slides. This informal measurement process is attached as an entire document in the lesson media section of this lesson. On this slide, we look at an informal method for evaluating quality of life. This method would simply use the case manager's assessment of the person's quality of life in the 7 domains that we discussed, using a 10-point Likert scale, with 10 being no problems whatsoever in that domain, and 1 being serious problems in that domain. We choose the higher number as indicating no problems, so that as the person improves, his or her quality of life, the overall number will increase. On this slide, we present an informal method for evaluating the person's level of functioning. Again, we would use the case manager's informal assessment in the 6 dimensions that we previously presented, using the same 10-point Likert scale. Over time, as the person that we are serving improves, this number should also increase. And finally, we present the 2 observational measures, days of hospitalization and days involved in community programs. Unlike the previous 2 assessments, progress for the individual would be shown by a decrease in these numbers. Please take a look at the complete document in the lesson media section. The programs in which we are working should feel free to edit and modify this document to the best interest of the program. The goal here is to move forward with some method of measuring the success of our services. That completes our presentation on measuring success in case management services. Please take some time to review the documents that are attached to this lesson. After you are comfortable with the information in this lesson, you are required to complete the attached quiz with a passing score of at least 70% in order to complete this lesson. Thank you for your time and attention, and good luck with the quiz.